great convoys of troops and reinforcements continued to move toward the beaches of Normandy.
He's looking at you, kid.
In 1944, after experiencing the death of his parents from cancer 13 weeks apart, Julius Perlmutter decided that something needed to be done with respect to care for cancer patients. He formed the National Foundation for the Care of Advanced Cancer Patients, which eventually became CancerCare. Perlmutter devoted his life to studying cancer and helping those in various stages of the disease. This boy's hospital treatment was paid by CancerCare. These were the type of services provided until the formal establishment of the Social Service Division in 1953, which is at the core of CancerCare today.
Our community needs many kinds of people doing many kinds of work.
CancerCare gained notoriety in 1958 when they presented the 32nd First Lady of the United States, Eleanor Roosevelt, the greatest volunteer in the world.
You guessed it, the Beatles.
We as a people will get to the promised land.
We choose to go to the moon in this decade and do the other thing.
CancerCare Week is proclaimed in New York City by Mayor Robert F. Wagner in 1964 to CancerCare's President Henry J. Heimlich, inventor of the Heimlich maneuver. Later on in the decade, CancerCare began providing grants for home care, which included nurses for bedside care and free medication for those unable to pay.
People have got to know whether or not their president's a crook. Well, I'm not a crook.
The 1970s led to numerous celebrity appearances at various events. In 1979, the CancerCare Thrift Shop opened, in which all proceeds benefit CancerCare's free professional services for people with cancer and their loved ones.
Mr. Gorbachev, tear down this wall.
Diane Blum joined CancerCare in 1984 as Director of Social Service and served as Executive Director from 1990 to 2009.
I, William Jefferson Clinton, do solemnly swear.
Let me tell you, the audience that you are addressing, the men that you are addressing, and they were all men.
CancerCare began providing one-hour educational cancer workshops in 1990. Leading experts in oncology provided up-to-date information in one-hour educational experiences.
Do you have family or friends or somebody who's helping you through this?
A few years later, CancerCare became a national organization with the establishment of its toll-free counseling line, which extended its counseling support groups, educational workshops, resources, and professional education to people throughout the country.
CancerCare, how can I help you?
In 1996, CancerCare launches its online presence with CancerCare.org. And the first edition of A Helping Hand, the resource guide for people with cancer, is printed.
By now, most people have heard of Y2K.
After the devastation of Hurricane Katrina in 2005, CancerCare distributed more than $500,000 directly to cancer patients through funding from the American Society of Clinical Oncology Foundation.
95% of the patients that come to the foundation are already distressed over the financial burden of medical treatments.
Since 2008, the Co-Payment Assistance Foundation has been able to assist over 80,000 patients and paid out over $138 million. 2008 was the year of the first Healing Hearts bereavement camp.
I, Barack Hussein Obama, do solemnly swear.
So help you God?
So help me God.
Congratulations, Mr. President.
My name is Trish Goldsmith, and I am the Chief Executive Officer at CancerCare.
In 2014, Trish Goldsmith brought her 20 years' experience in the oncology field to CancerCare. In 2016, CancerCare Patient Access and Engagement Report was created to learn more about how patients experience life after a cancer diagnosis. CancerCare then built on this report in 2017 with the CancerCare Patient Values Initiative, a multi-pronged, long-term initiative intended to change the national healthcare landscape, change the dynamics of individual patient decision-making, and change the experience for patients and families affected by cancer. The CancerCare Pet Assistance and Wellness Program will enable people with cancer and their caregivers to obtain care for their pets during the emotional, physical, and financial challenges of cancer treatment. In the next 75 years, CancerCare will continue to launch new initiatives, as well as continue to provide help and hope to all who experience a cancer diagnosis. Last year, CancerCare's programs and services helped 186,700 people affected by cancer in every state. 1 out of 3 people will get cancer in their lifetime. With your support, we'd like to be able to help as many of them as we can, because if it matters to you, it matters to us.